going to turn back the clock. Susana Franco joining us with a special guest.
Yes, we are turning back the clock. Thank you, Jeff. And we're doing it without having to go under the knife. Minimally invasive cosmetic procedures are becoming more and more popular. Joining us this morning, the founder of Art of Skin MD, Dr. Melanie Palm. Thanks for joining us.
Thank you. It's nice to be here.
Now, it used to be a trend where people would want to go under the knife to get, cosmetic surgery, but that's changing. Why is that changing?
It really is changing. You know, it's interesting. Every year, the American Society of Plastic Surgeons comes out with this data. And this past year, in 2012, there was 13 million minimally invasive procedures, and that really was an increase about 6%, while cosmetic procedures, those that are surgical, are decreasing. And it's probably because there's less downtime, it's less painful, and now they're getting so good that they can almost rival some of the surgical techniques of later years.
And that makes perfectly good sense. I mean, who wants to be having that downtime, having time after work, and
I know, we're in sunny San Diego. You want to enjoy the weather.
Exactly. Now, what are some of the procedures that you're actually seeing that are minimally invasive that are going up in popularity?
Sure. So I think, something we're going to talk about today is skin tightening procedures. So things that can sort of delay brow lifts, face lifts, neck lifts, that give turgor back to the skin, that give that suppleness and help eliminate wrinkles over time are always really popular procedures. Number one, though, is still botulinum toxins, things like Botox and Dysport. Say that's such an easy thing. You're in and out of the office with really predictable results.
And your office really focuses on a lot of the skincare products, a lot of the technologies. What are we going to be talking about today?
Yeah, so I'm a board certified dermatologist, but I also do cosmetic surgery as well. So I really specialize in minimally invasive techniques. So today we're going to be talking about a brand new FDA approved device. It was actually just approved 3 weeks ago. We were actually the first office that was trained in the United States. And it's the Lutronic INFINi, and it's radio frequency. So it's like special electrical energy that heats the skin gently, that's able, when we heat the skin, it causes new collagen formation, and that's what helps with fine lines, things like acne scars and skin tightening.
You're seeing more and more people toward this?
And I think what's so neat about this is it combines two technologies. It combines this radio frequency, but traditionally other radio frequencies, you had to go through the surface of the skin to down deep to the dermis where we want to build collagen. This one actually uses comfort flow technology to actually directly put the radio frequency where it needs to be in the dermis to build this. So it's great. It's minimal downtime, and the fantastic part of it, as opposed to other laser procedures, is it doesn't see skin types. So we can use this in African American skin, we can use it in Caucasian skin, we can use it in tan skin, which is so ubiquitous here in San Diego.
Now, is this something that hurts? Is it something that you have to have a topical cream?
So that's a common question. So we do a topical numbing cream, but with that, it's very comfortable. There was actually a large study that came from 4 other continents where this has been used. It's just gotten approved in the U.S., and it showed that discomfort during the procedure was really mild.
Okay, well, let's get to it. We have a brave soul here. What's your name?
Stacy Brown.
Stacy Brown. Yes. She's here and she's going to get the treatment today. So you can walk us through how it works.
Yeah, sure. So I'm just going to put the machine on.
So this is an INFINi machine.
This is the INFINi by Lutronic. So we're going to use this radio frequency. We'll do a couple little spots on her cheeks and then a little bit on the neck. The neck's a really popular place to try and tighten. So we will bring Stacy sort of over here. I'm going to come over to this side.
Sure,
And on 3, I'm going to do a little poke, and you tell me how it is. 1, 2, 3. How was that? And so we use this. It's about a 10 or 15 minute procedure. It's just used in little pads across the cheek. We do it in 3 passes in some cases. We're just going to show 1 here. But when we do that, we do it at different depths, so you can build collagen at all those different depths and really cause 3D volumization. And that's what gives suppleness and spring back and volume back to the skin. So tell me, how was that, Stacy?
I couldn't feel a thing.
Yeah, and so we'll do a little bit.
Feel a thing. So that topical cream is really helping. If she wouldn't have that topical cream, would you feel something?
It'd feel like a little stamp, so that's not something that's totally comfortable. So typically we always do topical numbing. I'm big on patient comfort, and I want people to be comfortable while we're doing procedures. So if we can make something almost completely painless and get really nice results, I think that's always a home run.
And it's something you do all over, or just like on the cheekbones?
Yeah, we do it the full face. We can even do it, forehead, above the brows for brow lift. We use it for fine lines around the eyes. For people that have acne scarring in the cheeks, I think this is a great alternative if they're not a good candidate for laser skin resurfacing. And then the neck, I think it's a home run.
And you say this takes about 10 to 15 minutes for the entire face. Now, after the procedures, what
what to expect afterwards. So you can have a little bit of pinkness to the face, and then usually about 2 to 3 days out, you have a little bit of sort of a sandpaper feeling to the skin, but you can put on makeup the next day. So it's something that really is minimal downtime.
Okay, and do you have to be covered from the sun? You have to be...
Yeah, I mean, anytime we do some sort of radiofrequency procedure or laser procedure, I tell patients to be careful with the sun, but that just means, you know, being good about sunscreen.
Yeah,
and
always,
wearing,
you should always be good about the sun.
Yeah, I wouldn't be a good dermatologist if I didn't say that.
And where can we get some more information about this?
Yeah, you can look at our website, since actually we're the newest one and sort of one of the only centers here at artofskinmd.com, and our phone number is 858-792-7546. We actually have an event coming up on August 28th from 5:30 to 7:30 where we'll do a live demo of this and have all sorts of specials.
There you go. And right there, our director was just showing our viewers the before and after. So here you can kind of see some of the before and after here.
So it's very dramatic, and again, this is for rhytids, but it's great for acne, scarring, and sort of tightening the skin as well.
Oh wow, what a dramatic change. Well, thank you very much for being with us.
Thank you. It was a pleasure.
Demonstration. You look beautiful. Your skin looks radiant.
Thank you very much.